Namaste. I'm Dr. Jaya Daptardar. Wish you all happy Women's Day. This is my honor and pleasure to be here today with Ayush Darpan at this wonderful occasion of International Women's Day celebration. Thank you, Dr. Shilpa Yerme, for inviting me. So, my today's topic is women's empowerment and global opportunities. Let me share my presentation with you. Okay. Hope you can see my slides. Okay. So, women's empowerment and global health. What is women's empowerment? Women's empowerment is not to power over someone. It's not about power over men. It has a very wide scope. Women's empowerment can be defined to promoting women's sense of self-worth, confidence, their ability to determine their own choices, and their right to influence social change for themselves and for others. A fundamental human right that's also a key to achieving more peaceful and prosperous world. Women's empowerment and promoting women's right have emerged as a part of the major global movement, and it is continuing to break new grounds in recent years. The International Women's Empowerment Day is also gaining momentum despite a great deal of progress in all these years. Women and girls continue to face discrimination and violence in every part of the world. So these are the ways to empower, and it has to start from us. It has to start from each and every one of us. So there are 5 ways that I have mentioned, but there are so many, and I know that. Global impact. So that global impact can happen, like I said, from each and every one of us. Doesn't matter healthcare workers, doesn't matter. If everyone starts from somewhere to empower women, we will not be talking all these things again and again in coming years. Empowerment quote, like standing up for equality. We are in 2021 and we still have to talk about equality. Global landscape. Gender equality and basic human rights is a global landscape, still needs empowerment in this area. Girls and women, empowerment for health and social development of the families. Then the 5th one is education. Basic to higher education is still a part of empowerment. Still, many countries are not 100%, do not have 100% literacy rate, and literacy is a major factor of the equality issue. And even the other issues of violence and women and families, and there are a bunch of others too. So, empowerment pillars, I call these empowerment pillars, that we have to make these pillars strong in coming years, because we have to have our goal. I mean, we have these International Women's Day celebration or Women's Empowerment Day talks. We all talk about it, but we have to find some goals that we can make strong pillars for women to empower. So, like I said, it has to start from us. Create high level of corporate leadership for gender equality where you work. I mean, wherever you work, it's whether it's hospital, whether it's clinic, whether you hire people in your house, you have to bring this higher level of um, leadership to educate or re-educate in this area of gender equality. And you also have to follow the guidelines for the equal pay, equal leaves, sick leave or vacation time. um, Treat all people fairly at work, respecting and supporting non discrimination and human rights. So it starts from each one of us how we treat, right? Ensure the health, well being, and safety of all the workers and co workers. Promote education, training, and professional development for women to empower them, to improve their confidence, uh, to give them confidence to be independent in their opinions, in their living. Champion equality through community initiatives and advocacy. So wherever, if you work with a community, promote in that community, promote in your own state, village, or your country, or wherever you are, advocate for it. Measure and report publicly on progress to create gender equality. So this is like, it's like I said, we have to pick up a goal, and we have to report the measures. What did we do for the whole year in this part, right? Um, then the next one is standing up for equality. And that also, we have to start from our own house, how we teach our children, how we bring this in our own family. Gender equality in terms of education, in terms of job and pay, equal pay. Help other women, help and support other women to rise. Uh, uh, be a mentor sometimes, or be a supporter, whether it's financial, whether it's voluntary, your time. Speak up. Speak up for the injustice for human rights. It doesn't mean that it has to be for yourself. It can be for some other women which you uh, feel that they need support, or they have injustice going on in the human rights point of view. So, next slide here. The global landscape of women's empowerment. So, uh, this is not something that is limited to us, or our family, or our clinic. This is, we have to create a global landscape of empowering women. as professionals, as especially healthcare professionals, we have to think about how we can educate our patients, how we can educate our communities in the gender equality. Is it is a basic human right, and it is also fundamental to having a peaceful, prosperous world. So this mindset needs to be changed, and this profession, doctor's profession, is the best for that changing mindset, because um uh, we communicate with our patients when it comes to giving a childbirth, or um, preparing the couples before giving birth to a child, and also treating babies, um, and talking to the families as a family physician. But the girls and women continue to face significant challenges all around the world. So this is not in just one country, it is all around the world. It is still happening somewhere. In the developing world, girls and women are often seen as less valuable than boys. It starts from the it starts from the own house. When I say own house, it's the own community, to educate about this equality. Well, some progress is being made in various part of the world, in various part of the societies. There is still a great deal left to be done towards the problem of this gender equality. Next slide. Okay. Why is empowering girls and women so important? Empowering women is essential to a health and wellness, nutrition, and social development of families, communities, and countries. We always say that when a woman is educated, then the whole family is educated, the whole community is educated. The same thing here. When women are empowered in terms of taking care of the health and wellness and nutrition, then the whole uh, family is empowered. When women are living safe, fulfilled, and productive lives, they can reach their full potential, contributing their skills to the workforce, and can raise happier and healthier children, families, communities. Education is the biggest part. It is a key part of the empowerment. Girls who are educated can pursue meaningful work and contribute to their country's economy later in their lives. They're also four times less likely to get married in young age when they have higher education, meaning that they and their families are healthier. So, next slide. Okay, global impact and empowerment. With COVID 19, this is the story uh, when there was a lockdown, and still there is a phase where we cannot go out. Everything is happening, schooling is happening from home, working from home. So in this situation, actually domestic violence against women and girls went 20% higher or more. It depends upon country to country. because there was no scope for these women and girls to uh, go out and express. So, according to the World Health Organization's data, violence against women, particularly intimate partner violence and the sexual violence, is a major public health problem, and it is a violation of women's human rights. Global estimates published by WHO indicate that about 1 in 3, that means 35% of women worldwide, have experienced either physical or sexual intimate partner violence or non partner sexual violence in their lifetime. Globally, as many as 38% of murders of women are committed by male intimate partner. So, this is dominance. Violence can negatively affect women's physical, mental, sexual, and reproductive health, and may increase the risk of acquiring HIV in some settings. So, that's where the doctor community, the healthcare community, um, comes in terms of the global impact and the opportunities. So here is what we need to concentrate when we examine the patient, when we do the clinical evaluation, when we see a patient, girls, women, if there are any signs, we can ask those questions. So many countries, like in USA, there is a questionnaire we have to ask and find out if there is anything going on, and then we refer to the case management, we refer to the authorities, we refer to the social workers if that's the need, but we identify the problem at the time of doctor's visit, whether it's the mental health related problem, whether it's trauma related problems, whether it's domestic violence related issues, or if there are signs that tells a doctor about it. So and that is the global opportunity, so that um, can be done worldwide, uh, to work on this area and have a goal that the next year we need to make sure that these types of uh, violence or impact, trauma, or mental health impact, that goes down percentage wise. It has a economic impact to it too. When that happens in the families or women, then their productivity rate goes down. Maybe some they cannot even work. During pandemic, a lot of things change. Women, they were some women, they cannot work from home. All the jobs are don't have opportunities to work from home, so they had to leave their jobs. Some they lost their jobs, or some because of the needs of the families and the kids at home, homeschooling, they had to compromise many things. So that affected financially, that affected economically in those countries' economic impact, health and hygiene impact. So limited resources, financial resources, family resources impacted the health and hygiene of the families during the the pandemic. So, global scope and opportunities. So, we already spoke about the opportunities and scope about the health and wellness impact for the women. What needs to be done as healthcare professionals? The global agenda of the health of women needs redefined and broadened to ensure the allocation of the adequate resources to increase awareness, promote research, and implement policies and interventions to prevent these impacts, and how to treat and optimize the outcomes. That also include the non communicable diseases in women. So, promote a life course approach to addressing sexual and reproductive health issues and wellness issues in women and girls, recognizing that such an approach has the potential to lead the reduction in sexual and reproductive health conditions. To design, evaluate, and deliver the best healthcare interventions, to improve the healthcare interventions and policies around it for the prevention and treatment of diseases in women. And again, I'm talking in general because country to country, the rules are different, policies are different. But we as professional leaders has to take a leadership um, to improve that. Appropriate number of women should be included in scientific studies, and the scientific study analysis should be done by the gender specific analysis where what the needs are for women than what are the needs for the men to improve. A systematic approach to the sex uh, disaggregated collection of data analysis and dissemination of the healthcare data is needed. Um, so uh, those are the things we as healthcare professionals can do to improve the outcomes in women. So, to ensure one third reduction in premature mortality in women, and that is not just non-communicable diseases area, but I'm talking about overall. It includes mental health and well-being, the sex specific impact of biological, behavioral, social, cultural, and economic factors in risk and outcomes needs to be addressed. Pathways and quality of healthcare for women for the prevention and treatment need to be addressed. Whether these pathways differ for women needs than the man needs, that has to be examined, and strategies to ensure that women and men receive the best available healthcare need to be developed and evaluated and implemented. So the next slide, feeling empowered. So with this, all these things that we spoke about, I'm really feeling empowered and looking forward to be a mentor and a part of improvement in these three areas that I have found they are most important at this time. So, be a part of the women's health awareness and prevention. Be a part of education awareness. And like I said, I'm empowered to do that. I'm already a part of this education and awareness. I'm a part of Ekal Foundation movement in India, which promotes the education for children, helping in making them independent in decision making. Definitely, we all have to be empowered to help women and girls in this area. So, thank you so much. And thank you for inviting me for this wonderful, wonderful Women's Day celebration. Thank you.